Thank you, Cheryl. We have time now for questions. I'm going to ask the faculty to come forward, those who are here. So if you have any last questions, this is your chance to ask it. We can start with Cheryl since she just spoke and the topics may be on your mind. Where did the mic go? Oh, good.
Questions in the chat too. So do you want to alternate or?
But
okay.
Let's get the.
My question is about protein powders and also protein shakes to try and boost up the amount of protein I get in my daily intake.
Yeah, so the question is about protein powders and protein supplements. Is that what you said? For boosting protein intake. So I, in general, do think that a lot of people need them, especially when your needs are as high as they are in this population. So I am a fan. And there's a wide variety on the market, from the very boutique organic brands to the more commercial grade. And you know, based on personal preference, I would say pick one that you're comfortable with. The main caveat I have with them is that the high protein shakes are usually for people trying to lose weight. So the high protein shakes are usually the low calorie ones. So you need to look for ones that are high protein and high calorie. Or add calories to them, yes.
From online? Or
Let's just finish
okay.
My question is for Cheryl. Just a quick question. On the Aerobica, how often should I be changing that?
Repeat the question.
How often you should be exchanging or replacing the Aerobica? We recommend package insert will say after every 6 months. It's generally every 6 months to a year, and you should be good.
Can I just be very clear about that? Because we have the label issue. So the label is 6 months. Yeah, but we think that a year is probably fine. Questions. We have some we can take from online that I think we'll learn from.
Let's see. It's a question for Dr. Hunt and probably for Cheryl. This is someone who lives at 7,000 elevation. She wants to know she needs to boil nebulizer equipment for 17 minutes, 10 minutes plus 1 minute per 1,000 feet above sea level in order to kill the NTM. I worry, at what point do I run the risk of plastic degradation versus killing the NTM?
Well, okay, so after all that, so what is my full question?
So I think it's a question about how long to boil. Wondering, do you boil for 17 minutes because you're at 17,000 feet? Or is 10 minutes okay?
7,000.
Yeah, 7,000. Sorry, she's not in.
You know what? I would probably say that all those case studies out there have touched base on different elevations and different areas. The 10 to 15 minutes is usually what I see when they're on higher elevations. So I don't, as far as scientifically, I can't comment on that.
Google. Yeah.
Yeah, 10 to 15 minutes is generally, if you're going to look at that, I would say 10 to 15 minutes.
Okay.
Okay.
I live in Denver. Denver Water sent me a testing kit to see if there was lead in my water. I've lived in the same house in question for 40 years, and now it was determined that there's lead in the pipes. And I think I'm about to have the pipes replaced by Denver Water, which will be quite an operation, very complicated. Have you folks made any link between lead in the water and lung problems?
I mean, I think there has been some studies with lead and NTM, but not to the point of like it's contributing necessarily to NTM. So, there's not very hard evidence in my experience that there's the lead contributes to NTM in drinking water. Well, that's probably good. That's probably good then. Yeah, it's probably a good thing.
What about other metals like molybdenum?
Yeah, the metals. Yeah, well, the metals we know, right? I talked about that earlier. Like it depends on what metal, I guess it is, right? Because certain ones are associated with NTM in the environment. So we talked about the molybdenum associated with MAC and vanadium associated with abscesses in certain geographic areas. So it depends on the metal.
Got an online question. What should shower heads and faucets be cleaned with?
Shower heads and what?
Faucets.
Faucets. Yeah, I mean, we talked about this all the time. It's like the typical, nothing has sort of changed from what we always talk about. Bleach is always good. Vinegar and water is always good. Just the standard, very cheap kind of things. You don't have to go out and buy like a very expensive detergent or whatnot, or disinfectant. All of those things still work really well.
This question is for Cheryl. I watched a webinar. I think it was put on by NTMIR. I can't totally swear to it, but anyway, it was put on. One of the segments was about airway clearance, and it was a Harvard respiratory therapist. Do you remember this, Amy? Okay. And please please concur with me on this. I believe that she recommended taking the in-breath with your nebulizer cup, that little green guy attached to the Ombra, and then breathing out with the aerobica so that you didn't breathe in and out of the aerobica and contaminate it. Can you give me your thoughts on this? Because that was not what I was taught to do here.
Right. And are you talking about the webinar that you watched? Does she have the nebulizer attached to the aerobica? Do you know? Okay, because the way we instruct and educate here generally would be with the nebulizer attached if that's how the doctor prescribed, and you have to breathe it in and out. You have to breathe it in for the aerosol and out to create that nice back pressure and percussion.
And do you think that that's okay? Breathing in and out of the same
absolutely.
Equipment?
Yeah.
Okay.
Well,
absolutely.
Because you're going to clean it. Yeah. If you weren't going to clean it, it'd be a problem, but you're going to be cleaning it every day. So it should be okay to do that. But if you're doing what she said, you have to breathe in and out for it to function.
Yeah. I recall the gal saying that she didn't want to have you rebreathing all of your bacteria. So anyway, okay. So you get a better benefit, therefore, breathing in and out of all that stuff hooked up together, the nebulizer cup and then the aerobica attached to it.
Oh, absolutely.
Okay.
Absolutely.
Okay. Thank you very much.
You're welcome.
And,
thank you.
My question is for the,
Oh, wait. I don't know who was first. We'll go here and then we'll go back.
My question is for the doctor from Hawaii, and it's about water. And since there was I went to a seminar here also in 2018, and I remember you were there.
Yeah.
But since then, I started boiling all my drinking water, and I put it it's in an electric tea kettle, and it just shuts off, after it starts to boil. So then we're reading that it says you have to boil for 10 minutes, drinking water. So am I wasting my time?
You mean using your kettle for boiling the water?
Well, if it doesn't boil for 10 minutes, is it killing the bacteria or no?
Well, it's probably reducing the number. I mean, it has to get up to that
wondering.
boil though, right? Like the temperature getting up there, it has to get sufficient time to be boiling and then exposing, right? So all of that time that is sort of warming and getting up, probably not, right? But when it's probably boiling, it's still the standard 10 to 15 minutes is good, but it's probably reducing at minute 2, maybe minute 3, but not,
It doesn't boil for 10 minutes. you know, the tea, everybody's got an electric tea kettle knows
Yeah,
that. It just,
yeah,
stuff out.
right.
So is it a waste of time, really? I mean, as
Waste of
compared to
time.
drinking water out of your refrigerator, out of your house, out of your faucets. I mean,
You mean like, so boiling it and in the tea kettle and drinking that water, whether it's you're gonna cold it, make it cold or keep
oh
it
yeah,
hot?
then I do
Yeah.
it at night.
No, I
and
think it's
by
probably still a
morning,
good
it's room
idea. Yeah.
Temperature.
Yeah,
But
yeah. I mean,
it's
still
a
putting in
lot
that.
of, it's a pain. I
Sure.
mean, it's just one more thing.
Sure. I mean, I say, be vigilant, but don't be over vigilant. I mean, if you don't do it that one time, right, it's not, right?
No,
necessary. Yeah.
Right.
Yeah.
Right. But just seems like, I'm wondering if it's a waste of time, since you have to do it for 10 minutes and it does not.
I mean, to the
work
point
for
where
10
it's like
minutes.
over, like affecting your life and it's taking some time, then,
Yeah.
yeah,
Okay.
yeah,
I'll just.
of course. Yeah.
So he was.
First, there have been studies which demonstrated that over 90-something% of bacteria are killed in like 2 minutes. So that's what she was saying. It will reduce it, but it may not sterilize it. And I think that's what I just want to make clear, that it will reduce the number of bacteria, but there are certain NTM that are more resistant. So, it might take longer to get those, like the Xenopi we talked about, that likes hot water, likes heat, like grows well at heat. It's hard to kill. But the real bottom line is that if you boil your water, is that really going to decrease your risk of getting NTM? It is if that's where you're getting infected from. But in your house, your water may be better than my water. I mean, the problem here is in my opinion, we overgeneralize these findings and kind of can get a little crazy about it. And there are definitely different things you can do to decrease the risk, but at the end of the day, nobody can tell you how much you are decreasing your risk. You see what I mean?
Your exposure is too, probably, right? Like where, there's so much, you don't know where the exposure kind of is coming from, right? And to Dr. Daly's point, right? It's one thing in the arsenal, right? In your tool belt that you can do, but it's not everything, right? And you could be not getting your exposure, like you said, from the water, but there's other places. And so, it's a kind of balance, I guess it is.
Can I add to that? Can I just comment to that first though? Remember what I said, I said something earlier about existing versus living. And this is kind of where that comes in. You do have to still live your life. Like when Fern was alive, she would drink, when we would go out to restaurants, she drank bottled water a lot because that's what she preferred. But she would drink tap water. When we were out at a restaurant, she'd just drink the water. In terms of the boiling water, I mean, I have to do sinus washes constantly. So I have the same problem with the electric kettle. So what I do is I have an electric kettle and I have a little stovetop kettle that whistles. I boil it in the electric kettle, put it in the stovetop kettle. As soon as it starts to whistle, open the spout, set the timer. As soon as it's done, turn it off. And that's what I do for sinus washes, because for a sinus wash, you need sterile water. For drinking water, again, it's a matter of it's a matter of mitigation. You're not, unless you live in a hermetically sealed bubble, you cannot prevent exposure completely.
I drive up from Colorado Springs because it's the #1 pulmonary institute in the world, in my opinion, at least in the nation. And because of the great doctors and the RTs and the dietitian and the all-around support here, there is a bill in Congress and Senate called the Supplemental Oxygen Access Reform Act that's currently in Colorado's House and Senate. So I'd like to send you all a link. You can send that to the patrons that are here, and if they so desire, they click on that, fill out their name, add an additional patient comment if they like, and it will determine based on your address where to send it to the right senators. There's only 2 of them, and the right congressman for you. And there's 2 links, one for Congress and one for Senate. So I just want to make that announcement. This is something that Alpha One Foundation's working on, and also the RTs, 100 RTs will be in Washington in May, going out and lobbying for this act because it improves the ability of the respiratory therapists to bill directly to the organizations instead of having to go through a doctor. It gets better patient care. And it also improves and gets back the ability for high flow oxygen patients to get liquid oxygen again, which has been discontinued throughout the nation. So I really encourage people to look at that. If you guys will send it out and do your lobby efforts. It's a simple 5-minute exercise.
Is this for the state of Colorado or is this nationwide?
Nationwide.
I'm going to give you my card. If you send it to me, we will make sure it gets out to all our patients so that
I'll
they
give
can
you
fill
a
it
card.
out.
Thank you.
And I strongly, when we get that out to you, I would strongly urge you to fill it out and send it. And if you feel like making a follow-up call to your Congress critters, you should do that too.
I suspect as a nonprofit organization, we would be limited unfortunately, by sending out anything political. So that would have to go all the way to the top. So what I was going to suggest is let her do it. Yeah,
We got you.
it'll still get done, just a different mechanism. Yes,
Let me
sir.
go back to the water boiling question. Excuse me. It's hard for me to accept that the water inside any bacterium will not coagulate the cell after boiling for a minute. Okay. So I'm sorry too. How can just from the thinking of physics, how could the water inside of any bacterium not coagulate after it's reached 100 degrees centigrade for 2 minutes? How could it be possible? Has anybody tested this? I mean, it's a old wives' tale. She said it's accepted, but doesn't mean it's current or exact.
Based on studies.
Give the mic.
Here, it's on.
So there are multiple studies that have been published where they put a known concentration in a water bath and they heat and they sample it. But the results of those studies have varied a lot, between showing very rapid kill to taking a long time. But the 10-minute thing is to make it sterile. Nothing can survive. Remember, some of these things, these cell walls are impressive. And again, these are studies where they sampled Mycobacterium xenopi over time, and it takes longer to kill xenopi than it does MAC. I have a friend who, he never published it, but he inoculated a water bath with MAC, and he boiled, and he said, he said, this is Tony Catanzaro, if anyone, yeah, that he was able to isolate mycobacteria up to 10 minutes. I don't know how, but that's what he found. This doesn't sound right.
Boiling water at sea level is 212 degrees. In Denver, at 5,000 feet, that temperature of boiling water is about 190. So accept 190 as your boiling temperature. Now, the thing you need to change is the time, because it's going to take longer at 190 degrees to sterilize than it does at sea level. So one of the old tricks around altitude is, let's say 10 minutes boiling time at 5,000 feet. For every 1,000 feet, increase your time by 2 minutes. If you're at 7,000 feet, it's 10 minutes plus 4 minutes, 14 minutes. Remember, you're cooking it at a temperature. You're sterilizing at a temperature. So if you, it's like potatoes. You go in the mountains, you take a baked potato up there and put it in a pot. Down here on your stove, it's going to take, say, 15 minutes. But at another 5,000 feet, it's going to take 20, 22 minutes.
Thank you.
2 minutes per 1,000 feet above 5.
We have anything in the chat?
There've been a couple questions about what kind of water heater to use in your house, tankless versus not. If you can talk about if there's any guidance there.
I mean, well, tankless is a good suggestion. I mean, that's always a nice system to use preferably. I mean, the water heater is still, if you're going to have a water heater, the standard thing is to flush it out often enough, right? And clean it out and have it set at 121 for, you know, how many minutes or whatnot at a certain temperature. I think it was 131 at that point. So, I mean, either or, right? But as long as you're maintaining either system, probably is still a good bet.
Yeah, I'll just weigh in on this. When I was here before the pandemic, I was here speaking, and back home in Miami, why my pipes were getting replaced and my water system, my water heater was getting replaced. And Joe Falkenham was here, and I said, Joe, should I just get another tank or should I go tankless? He said, get a tankless water heater. So I did. You know, he told me what temperature to have them set it at and everything. So there you go. And there are actually some things you need to take into consideration if you go tankless in terms of where you position it in the house, if you have to have more than one and where it's situated, how old the house is. So, and Joe has all that information too, because he had me get it from my plumber.
I think we've hit the witching hour.
You want me to put a hex on somebody?
No. So I'd like to close the conference. I want to thank both those online, those here. It's been a great day. We've had a lot of good discussions. We answered approximately 200 questions online today. That's what Dr. Haas and I were over there just typing all day, trying to listen and type at the same time. We did not get to everyone. There's still some left over. We apologize to those online that if we couldn't get to your question. We do appreciate your attendance. So I'd like to thank everyone here. The faculty, Nisi, Megan, Andrea with ProEd, who did all the work behind the scenes. Thank you. If you still have questions, some of us will still hang around, but enjoy the rest of your weekend and hope to see you next year. Thank you.